Welcome to the second video of the Dementia Isolation Toolkit training series. In this video, we will talk about the Person-Centered Isolation Care Plan tool. If you haven't already, you can also check out the first video, which gives an overview of the other tools in the Dementia Isolation Toolkit. The Dementia Isolation Toolkit is designed to help care teams in long-term care homes provide ethical care during the pandemic. Person-centered isolation care planning for people with dementia living in long-term care is an important part of the toolkit. We know that care teams aim to provide the best care possible for the people living in long-term care, despite the challenges presented by COVID-19. As discussed in the previous video, infection prevention and control measures have become central to our care processes so as to avoid and manage COVID-19 infection and outbreaks. One such measure is the quarantine or isolation of individuals. This happens for a variety of reasons, including when people first move in, are returning from a hospital visit, are suspected to be infected with COVID-19, or have tested positive for COVID-19. Isolating someone is always difficult and is especially challenging for residents who are living with dementia. Someone with dementia may find it hard to understand why they are in isolation, or to remember that they mustn't leave their room. They may also suffer more than usual from the isolation and lack of family visits, and can feel rejected or abandoned because they don't understand why their loved ones are not there. This is why applying a person-centered approach to isolation care planning is more important than ever. We need to mitigate the risks and harms of isolation while still effectively maintaining infection prevention and control measures. We understand that person-centered approaches can be difficult to implement even when we are not in the midst of a pandemic. Time, budgets, and staffing are some of the barriers to implementing person-centered care. During the pandemic, these are all even bigger challenges than before. With that in mind, this person-centered isolation care plan tool was designed to assist you and your team in implementing person-centered care as best as you can in order to support people in your home who need to be in isolation. The aim of this tool is to help you develop a personalized care plan that takes into account information about who the isolated person is and what is important to them. Everyone has unique needs. It's important to identify and try to meet those needs rather than seeing them only as a problem that needs fixing. We also want this tool to help you feel empowered to find creative ways of fostering joy and a sense of security for everyone during these often sad and frightening times. To walk us through the person-centered isolation care plan, we'd like to introduce you to Rhoda. Rhoda is a composite character we've developed to help us demonstrate how to use the care plan. Rhoda is a resident who needs to be isolated for 14 days because she may have been exposed to a staff member with COVID-19. It quickly becomes clear that this is not easy for her. The first step is a conversation with the care team to reflect on what you know about Rhoda. You can use the person-centered isolation worksheet to help you guide your discussion and capture information. The first section gathers information about Rhoda's personhood. For example, your team knows that Rhoda is a former nurse. She moved into long-term care home 6 months before the pandemic started and adjusted quite well due to her familiarity with care settings. Rhoda is very self-sufficient, having never been married or had kids, and seems to see herself as part of the team, often wanting to help others in the home. Rhoda leaves her room because she wants to help and stay busy. Sometimes she thinks that her isolation is some sort of punishment, but doesn't know why she's being punished. So she leaves her room to ask the nurses what she did wrong. Your team has noticed that validation, reassurance, and redirection seem to help Rhoda return to her room. The second section of the care plan looks more specifically at activities that are engaging for Rhoda. Before the pandemic, Rhoda's nephew would bring her to church every Sunday. Rhoda was part of the church choir and loves sing-alongs, especially to old songs that she knows. While it doesn't replace the social aspect of going to church, music and singing is something your team thinks they can help Rhoda do in her room while in isolation. Rhoda also enjoys having tea with others and reminiscing about her nursing days. If someone on the care team is available, it is helpful for Rhoda to have a chance to chat over tea with someone. She does not seem to have a preference for which member of her care team she likes to chat with, so long as they can relate to her experience as a care provider. The next section asks your team to consider what Rhoda specifically needs help with. It's important to note that these needs are not necessarily related to care tasks. It can also be about what brings Rhoda joy and pleasure. Remember, she is isolating for the good of others in the home. How can you reciprocate and make sure her needs are met while she does so? For Rhoda, some of the ideas from previous sections can help us fill out this section and understand her needs. The following section looks at reminders and what does and doesn't work to remind Rhoda to stay in her room. Luckily, because Rhoda is a former nurse, she has a strong understanding of the need for PPE and infection control measures. The sign from our DIT communication tools is effective in reminding her to put on a mask before leaving her room. A verbal reminder from staff is often enough to help her return to her room. However, because she is so busy and active, she frequently leaves her room, so a door alarm may be helpful to keep staff aware of when she has left her room and to stop her from entering other residents' rooms. This tool covers a lot of information about someone. However, you shouldn't feel pressured to fill out every box all at once. You may not know some of the answers right away. This tool is a document that care teams can update over time as you try new strategies and learn more about the person's needs while in isolation. We recommend filling this out during huddles or other conversations where multiple people can contribute their insight into Rhoda's personhood. Finally, based on all the ideas identified in the previous sections, the last piece is to identify the specific approaches that your team plans to use in order to support Rhoda while she is in isolation. This plan is the part that needs to be communicated to the rest of Rhoda's care team so that everyone is on the same page in how to support her at this difficult time. In the toolkit, there is a one-page care plan summary that you can use for this purpose. A person-centered isolation care plan is meant to be adapted over time as your team tries strategies and the situation changes over time. We know that people's needs may evolve, and therefore this tool should be revisited and updated when necessary. Through the steps outlined in this tool, you and your team can develop and implement person-centered care plans for people requiring isolation or quarantine. Ideally, these plans will help us remember to support the residents' well-being and mitigate the negative effects of isolation in one's room. We also encourage you to reach into your toolbox. You have the expertise, the training, and the first-hand knowledge of working with people who live in your long-term care home. Remember to use what you know and adapt it to the situation at hand. We've developed a poster you can use to help remind you and your team about approaches that may help you practice with person-centered care in mind. These tools are meant to be used in tandem with the ethical guidance tools. If you haven't already, please check out the first video for more information on how this toolkit can support you through the ethical dilemmas you may face while providing care during the COVID-19 pandemic. Thank you for taking the time to learn about the tools in the Dementia Isolation Toolkit. If you use these tools and have any feedback, please share it with us at www.dementiaisolationtoolkit.com.